Dysphagia due to stricture is a major problem for patients with esophageal cancer and can reduce their quality of life even if the esophageal cancer has been cured. Endoscopic balloon dilation, EBD, or esophageal dilation with a boogie-type dilator is usually the primary treatment for dysphagia due to esophageal stricture. EBD has been reported to be safe and effective for strictures both after esophagectomy and after non-surgical treatment such as chemoradiotherapy, CRT, or endoscopic mucosal resection, EMR. While over 90% of patients became dysphagia-free after repeated EBDs, there was a significant difference in the median time to treatment success between the group with strictures following non-surgical treatment and the anastomotic stricture group, 5.6 versus 2.3 months with a p-value of 0.02. Furthermore, the group with strictures after non-surgical treatment had severe refractory strictures that required 6 or more repeated sessions of EBD compared with the anastomotic stricture group, 75% versus 45% with a p-value of 0.01. Recently, endoscopic radial incision and cutting method for refractory esophagogastric anastomotic stricture has been reported to be highly successful, with improvement in dysphagia maintained for 12 months after the RIC procedure in more than 60% of the patients. Thus, the RIC method is recognized as a safe and effective treatment for refractory anastomotic stricture after esophagectomy. Strictures remaining after non-surgical treatment for esophageal cancer are generally more refractory to endoscopic balloon dilation when compared with anastomotic strictures. Yano et al. Evaluated the efficacy and safety of a radial incision and cutting method for the treatment of refractory strictures after non-surgical treatment such as EMR, ESD, or CRT of esophageal cancer. Their findings are reported in the paper entitled Radial Incision and Cutting Method for Refractory Stricture After Non-Surgical Treatment of Esophageal Cancer. The authors included in their study 8 consecutive patients with refractory esophageal stricture, grade 2 or worse dysphagia, even after at least 10 sessions of EBD after non-surgical treatments, including chemoradiotherapy alone, 3 patients, CRT followed by salvage endoscopic treatment, 3 patients, or endoscopic submucosal dissection, 2 patients, who underwent the RIC procedure. The RIC procedure was performed with an improved type insulation tipped knife under endoscopic observation with a 9.2 mm diameter endoscope because subjects had longer and tighter strictures than are usual with anastomotic strictures. After the RIC procedure, dysphagia in all the patients improved dramatically to grade 1 or 0 without any major complications such as perforation or bleeding. A median of 2.5 sessions, range 0 to 4 of maintenance EBD, was performed after the RIC procedure. The short-term effect and safety of the treatment in this group was similar to the outcomes for patients with anastomotic stricture. However, the long-term efficacy was unfavorable as only 37.5%, that is 3 out of 8 patients, demonstrated adequate lumen patency at 3 months, and re-intervention was necessary in 6 patients, that is in 75% of the patients. The difference in long-term lumen patency between non-surgical and anastomotic strictures may be due mainly to the length of the respective strictures. Severe fibrosis in a large area after radiation or mucosal resection results in strictures with longer and tighter features than common anastomotic strictures. The administration of steroids after the RIC procedure has the potential to reduce restenosis and would be valuable to investigate further. Metallic stent placement for refractory esophageal strictures is reported to reduce dysphagia score, but results in hypoplastic tissue reaction causing fistula formation and restenosis after stent removal. A biodegradable stent has been reported to lead to favorable results without any major complications. This needs investigation. In brief, RIC for refractory esophageal strictures after non-surgical treatment of cancer does not have long-term success.